Hi there. I've been following the debate in the USA about the health reforms, or the proposed health reforms under the new government over there. And up comes a little video about the British health system. And I watched what the Americans were saying, or I guess it's the opponents of President Obama's plans who made this video, basically slating the British health system and saying that so many people in Britain can't get proper health care because we only have this appalling government-run system. And so I thought I'd come on here and set the record straight. First off, yes, I have used twice I've used, personally, the National Health Service in the UK. I haven't had to wait. I've been referred to the hospital by the doctor on 2 occasions, gone straight there and had very good treatment. But in the UK we don't just have the government-run National Health Service. We do have private health insurance. If you want to take out private health insurance you can, and then if you need medical treatment and you don't want to wait in a queue or whatever, and I'm not talking about emergency treatment here, because emergency treatment you get anyway, but if you want some other stuff which you would normally be asked to wait for, because a lot of people want it, then you can jump the queue, if you like, by going private. So we have the two systems here in the UK. We do have the National Health Service, we also have the private health service, and it's up to you which one you choose. Apparently in America there are 47 million, approximately 47 million people without health insurance, and there is no National Health Service as a backup, and so they don't get their proper medical treatment. I believe they are given emergency treatment, life-saving treatment, but other more routine medical treatment, they basically are either denied it or they have to wait a long time for it. So it seems to me that in America you have only the one system, that's the private system. You have medical insurance, private medical insurance, which entitles you to get your private health care. So from my point of view, the way I understand it, Britain actually has the advantage, because we have the private health insurance and the private health care, but if you can't afford that, if you were one of the 47 million Americans, but you were over here in the UK, you would actually have the National Health Service to fall back on, so you could get the medical treatment. You probably wouldn't get it as fast as those on private healthcare, but you would get it, and you might even get it as fast, because it just depends how busy they are at the time. Obviously in medical care you have to prioritise. It's the main priority is people whose lives are in danger, matter of life and death, and then it goes way down the line, and the least priority I guess goes to things like cosmetic surgery just for vanity and whatever, which really isn't medical at all. So it seems to me, as somebody in the UK, that in America there's a lot of fear and a lot of paranoia, and people seem to be really worried that I heard one woman say that she doesn't want America to become a Soviet state regarding healthcare. Well, I don't think that's what's being proposed. It doesn't sound like it, and if it becomes like Britain, believe me, it's nothing to do with the Soviet state. What you will get, they're not apparently proposing the British system for America. But if they did, I would have to say it would not be a negative thing, because you would then have, you could call it a 2-tier medical system, but I'd prefer to say that, you would have your private health care as normal, and with that private health insurance, rather, you would be entitled to that private health care the way that you always have been. But if you're one of those 47 million who don't have private health insurance, who can't afford it, then there would be that medical treatment available for you, where at present it is not. So what is the objection? Because it seems it's not going to affect people who are already on the private health insurance scheme, where they do get medical treatment. It will affect those who currently are not able to get medical treatment. It means that they will be able to. So that's what I'm wondering about. Why are people complaining? What's wrong with that? What's wrong with those who can't currently afford to go see a doctor or to get an operation having some way of being able to afford to do that? Yeah. Maybe I'm missing something. I don't know. But I just wanted to put the record straight about the British health system. We are not poverty-stricken in the sense of healthcare, the way that the American video was trying to portray us. We don't have thousands of people queuing up for medical care, having to wait months to get medical treatment. It's not like that. There are some people who do end up having to wait a while. It's not because nobody cares. It's because there's maybe an overload in the system. But if those people have private health insurance, they can get health care quicker, as you do in America at present, if you have private health insurance. So it seems that Britain is better off because we have the best of both worlds. America only has the private health insurance system. If you don't have it, you don't get medical care. Whereas in the UK, if you don't have it, you do get medical care. So from my point of view, the British system is better. And I don't know why America is panicking. And let me know what it is that you're objecting to. What are your fears? Why are you so distraught about those less well off being able to have medical care in the USA? Yeah, I just want to know, really.